Hi, my name is Dr. Vicki Norton, and I'm an emergency physician and a board member of the American Academy of Emergency Medicine. The Academy was founded in 1993 out of concern over the corporate influence in emergency departments, specifically about the quality of care and the treatment of physician employees. To this day, AAEM continues to advocate for the bedside physicians and against corporate control, which we view as putting profits over patients. Unfortunately, I've personally experienced the negative consequences of corporate ED consolidation. When I graduated residency, my first job was at an HCA hospital in Southeast Florida, where the contract to staff the emergency department was owned by two physicians. I moved across the country with a newborn daughter and bought a home in the area. I found out a month before I was to start that the two physicians had sold the contract to a corporate group called Sheridan, who in turn had a deal to staff both the radiology and the emergency departments. I was given an employment contract and told, take it or leave it. The contract had a restricted covenant and a non-interference clause. The other emergency physicians working there attempted to talk to the hospital administration to take over the contract themselves as a group and were denied, likely due to this arrangement with the bundling of staffing contracts. The quality of care at the site and the treatment of the physicians working there became so bad over the next 2 years that the entire original group of physicians who had staffed the ED for over 10 years ended up leaving, including myself. What I didn't know at the time was that HCA's entire Southeast division was under direction to contract with corporate groups, and specifically in many hospitals, to staff the ED through a joint venture with Envision. Currently, the ED in the hospital I left is staffed under this arrangement, and I've heard from colleagues that it's worse than ever working there. I luckily ended up at my current position with a physician-owned Democratic group at a nonprofit hospital in my hometown. Given the lack of jobs like this in my area, I could safely say that if my group ever loses its contract, I would either end up moving out of the state completely or leaving emergency medicine altogether, a profession I have always viewed as a calling. Thank you so much for the opportunity to speak about this.